Hey, future medics, it's me, Tina, your medic mentor, and I have missed you. I'm finally on the mend. I am so ready to jump back in to where we were, which was breaking down the axial skeleton. Today, we're going to be starting with the skull, the most important part in your body because it protects the one thing your patient can't live without, the brain, of course. Now, we're going to break this down so it all makes sense. We're going to solely focus on the cranium today, and then we'll go into the facial bones later. Now, the whole skull is made up of 22 bones. The cranial vault is 8, and the facial bones are 14. There are 8 cranial bones, and when we do neurology, you will see that the names of these bones often correspond to the lobe of the brain that is below them. But we'll get into that later. So our 8 bones are, this blue one is the frontal bone. There is 1. But when we start looking along these suture lines here, you see, those are separating bones. They're fused together now, but it means they were 2 different bones. So while the frontal, we had 1, this green parietal, there are actually 2 of them, okay? Also, this peachy color is your temporal, and there is 1 on each side. So there are 2 of those as well. This gray is your occipital, and there's only 1, just 1 of them. Now look at this little pink inside. This is the sphenoid bone, and it looks really small, but when I open this up, you're going to see it's actually bigger than it seems. But look here, if you look inside, you see this white line here? That is your ethmoid. It is actually rather small. It makes up your sinuses. It's actually really important. If you look inside, the brain would obviously sit here, and then you have the base of the skull. So your occipital, your frontal, your temporals, they make up the base of the skull. But also this pink one is the sphenoid. So it's actually a lot bigger than it seems like it was when we looked on the outside when we were just looking here. The sphenoid's actually very, very large, and it helps form those front sinuses and the cavities. It's also known as the keynote or keystone bone because it is the keystone that makes and forms the skull. So that one's really important. Now, if you look at this white right here, see if you can see a little bit better. It's actually kind of spongy. You see some holes in there. Goodness, there it is. That is the ethmoid. The ethmoid bone is also coming up into here. It is spongy because it is part of our sinuses. Ooh, it's part of our sinuses. And so it actually has cells in it that will make mucus because it's part of our sinuses. So that is our bones. That's what they look like. That is how they are oriented. Now the suture lines that I show you show where all those bones fuse together and form one hard plate that protects our head. They don't fuse until after birth, and that is important. I'll tell you why. An infant's head, when it's first born, it's not fused together like that. We have suture lines and things that hold it together, but they're kind of free-floating plates, almost like tectonic plates, right? They kind of are near each other, but they're not fused. And it's so that kids' head can mold to squeeze out of the birth canal, because if it was all fused together, we wouldn't be able to get the kid out. So it being pretty squishy and not fused allows it to flex and to get out. But also, in the first year of life, your brain goes through rapid rate of growth. We need to allow for that room. And when we have a rock hard skull, that's not going to happen. So it being flexible and pliable and not fused together yet allows that brain room to grow. And then we say, all right, well, this is where we're going to be at. And that's where it starts fusing together in the shape that it needs to be and in the width and the length that it needs to be. This is important. It leaves us with 2 soft spots. And you've heard of the soft spots, fontanelles, on a child's head. There's actually 2. There's an anterior, which closes at about 18 to 24 months. And there's a posterior, which closes about 2 to 3 months. Now, these are important for our patient evaluation skills. Okay, so whenever we find that fontanelles is bulging up, if you just lightly run your fingers over the top of it and you feel it bulging, this it indicates to us that there's significant intracranial pressure going on. So there could be head trauma, could be meningitis, hydrocephalus, things like that. Tells me a lot about what's going on with the kid. Now, if I run my fingers over those soft spots and I feel that it's depressed, I'm thinking dehydration. Maybe the kid has not been feeding well because they can't latch. Maybe they're dehydrated because they are vomiting or having a lot of diarrhea. Tells me a whole lot about this kid's status. But remember, you want to go over this really gently. Like, we're not poking into anything. Just if you run your fingers, the first one's about right here. If you run your fingers over the top, you'll be able to feel if it's bulging out or if it's sinking down. And also back here, just kind of run your fingers over and you'll be able to tell. It tells you a lot about these kids, which is helpful for us in the field without any imaging. But that's it. That's it for the cranium. Next, we're going to go into these little facial features, these tiny little guys. Some are even tucked away under here, but I'll help you with it. It'll be fine. You're doing a good job. We're laying a foundation and we're just building them bit by bit. I believe in you, even if you don't believe in yourself right now. I'll see you soon.